Hello, my name is Bridget. I'm a South University nurse practitioner student. I'm going to be doing your physical assessment today, okay?
Okay.
I'm going to go ahead and sanitize my hands. Can you tell me your name and date of birth?
Raven Lumpkin, February 7, 2002.
Can you tell me who the president is?
Joe Biden,
Can you tell me what day of the week it is?
Monday.
Okay. So she's alert, she's oriented times 4, she's well groomed, she's dressed appropriately for working out because that's what she's going to be doing. So she's dressed appropriately for that. I'm going to go ahead and give you her vital signs. We reviewed them already. Her blood pressure is 120 over 60. Her heart rate is 78. Her respirations are 18. Her temperature is 97.6. Her O2, SpO2 was 100%. Her weight is 200 pounds. Her BMI is 30. I'm going to go ahead and assess her skin. Is it okay to touch her skin?
Yes.
Okay. Her skin is warm, dry, clean, and intact. She doesn't have any bruises, lesions, or wounds on her skin. The hair on her arms are evenly distributed, and her skin color is appropriate for her ethnicity. I just noted that she have tattoos on both sides of her arms, which is fine. I'm going to go ahead and palpate her head. Her head is symmetrical, it's midline to her shoulders, it's a round shape. Are you having any pain?
No.
Any discomfort? No. I don't see any bumps or lumps or lesions. She hasn't had any pain or discomfort. Going to palpate her temporal pulses. They are 2+. I don't feel any threadiness or bounding. They're normal. Okay. Going to go ahead and continue palpating her head. Any pain?
No.
Okay. I'm gonna go ahead and go to her eyes. We do head eyes. Okay, I'm looking at her eyes. Her eyes are round. I don't see any drainage or lesions. I'm sorry, I don't see any drainage or anything from her eyes or redness from her eyes. I'm gonna go ahead and do finish her facial exam. Go ahead and close your eyes. Don't let me open your eyes. Okay, very good. Raise your eyebrows, puff your cheeks, smile, clench your jaw. Any pain?
No.
So there's no TMJ and no pain, no pain. Now I'm going to continue to her eye exam. I'm going to start with Snelling chart. This is going to be 20 feet. Go ahead and read the smallest line that you can read.
8745.
Okay, on both the other eye.
8745.
Okay, thank you. 8745 is the smallest line on here. Okay, we are going to go ahead and check her vision. So what I want you to do is just follow my finger, okay? Very good. Follow my finger. Very good. Then we're going to check for accommodation. When you see my fingers wiggling, let me know. Cover one eye, and I'm going to cover an eye.
I see this. I see this. I see this.
Good.
I see this. I see this. I see this.
Okay, so we're going to check to see if we can see the redness in your eye, which redness behind your eye, which that's what we should see. Look at my nose. I see the red. I see red. Okay. Your pupils are round, as they should be, and your pupils are size 2. But we're going to check for if your pupils are equal, round, and reactive. Okay. Look at me. Very good. Pupils are equal, round, and reactive to light. They are 3 centimeters. Go ahead and look up for me. Her sclera is nice and white. Her conjunctiva is pink. I don't see any drainage from her eyes anywhere. I don't see any. I didn't know any nystagmus or anything like that. I'm going to look at her ears. I'm going to palpate her ears. Any pain?
No.
I don't feel any lumps, bumps, or bruises in her ears. I'm going to turn this. I just put it upside down. Look at her ears. Any pain?
No.
Okay, I don't see any bulging eardrums. I don't see any drainage. I don't see any nodules in your ears. They are pearly, white, and grayish as they should be. We're gonna go ahead and test your hearing. I'm gonna whisper something in your ear, and you tell me what I said. Okay?
21,
Good.
49.
Very good. Now we're going to do the Weber test. When I hit this, I'm going to place it on the top of your head and tell me if you can hear sounds in bilateral ears. Okay? Both ears. Can you hear this? Okay, very good. Okay, now we're going to check the bone conduction over air or air conduction over bone. So I'm going to hit this. I'm going to put it on the bone on the back of your ear. When you can no longer hear it, let me know. And I'm going to put it in the front of your ear when you can no longer hear it, let me know, okay? Very good. From the other side, when we do the one ear muscle to the other. Nice.
Okay. Okay.
Very good. That's what we wanted. We wanted air over conduction, so you should hear air longer than conduction. All right, now I'm gonna assess your nose. I don't see any nasal polyps. I don't see any drainage. I don't see any scars or anything in your nose. And your turbinates are equal. I'm gonna now look in your mouth. And put on my gloves for that because we're dealing with oral secretions. So I'm gonna put these on. Okay. Go ahead and open your mouth, stick out your tongue, lift it up, down, side to side. I'm gonna look at side. I'm sorry. I don't see any ulcers or anything on her the palate of her mouth. I'm gonna look at her uvula, say her uvula is symmetrical and it lifts up and down as it should when she says ah. All right, I'm gonna go ahead and check her thyroid. So her thyroid is midline, it's not swollen, it's the size that it should be. Go ahead and swallow. When she swallows, her thyroid does move up and down. All right. I'm gonna assess her neck for range of motion. All right. Look to your left. Look to the other side. Look up. Look down. All right. Very good. I'm gonna go ahead and palpate your in front of your lymph nodes. Any pain or tenderness? Any pain or tenderness? No. Look up. Okay, eyes look good. I'm also going to check to see if she has feeling in her face by using a cotton ball. And let me know if you feel this.
Yes. Yes. Yes.
Okay, I want to just go ahead and do you.
Yes.
Do you feel it on your legs?
Yes. Yes.
Okay, I just did her feet because she has on pants, so just want to make sure she can feel it all over. That's how I normally do my assessment. I'm gonna go ahead and palpate here for and here for lymph nodes behind the ear, in front of the ear, down the back of the neck, and the clavicles. I don't feel any lymph nodes, which is good. I'm gonna go ahead and do your brachial epitrochlear lymph node in your arm a little bit. I don't feel anything there, and I shouldn't. So that's good. So I don't feel any lymph nodes. Did you feel any pain when I palpated any lymph nodes?
No.
So all of her lymph nodes are good. There's no sign of infection. They're not swollen or anything. Okay, so now I'm going to look at her shoulders. Her shoulders are midline. There's not one up higher than the other. Go ahead and shrug your shoulders for me. Her shoulders are strong. Okay. Her clavicle is where it should be. I know that because I did her lymph nodes. Um, oh. Let me do your range of motion of your arms. Okay, put your arms out. I'm gonna bend up. Does that hurt?
No.
No pain? No pain? Okay. Push up on my hands. All right. Push down on my hands. Very good. Put your hands back like this. I'm gonna pull. Okay. Very, very good. She's very, very strong. Squeeze my fingers. Okay, very good. Yeah, girl. Very strong hands. Okay. Um, do like this for me. Do like that. Take them out. Very good. Over your head. Good. You got full range of motion of your shoulders. Go ahead and stand up for me. Take your arm and put it behind your back like this. Turn around. Take it up as far as you can with your thumb up. Okay. Very good. Do the other hand. And it's aligned. Go ahead and stay standing. I am going to do, I don't know what I'm going to do. I'm going to do your chest. I think I had you stand up when I did it before on the chest, just so they can see better. Turn this way. So I'm going to listen to her breath sounds and her heart sound. I'm looking at her chest. Her chest area is symmetrical. She doesn't have any barrel chest. Her AP diameter is within range, 5 to 7. She's breathing easily, and I'm going to go ahead and check her breath sounds. Take a deep breath. Blow it up. 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 All right. I'm going to also listen to her heart because I'm already on the front of her chest. I'm going to start at the aorta, the second intercostal space, or aortic. With the diaphragm. It won't snap. Oh, there it goes. There it goes. Okay. Then I'm going to go over to the pulmonic. Very good. To the tricuspid. To the mitral valve. And then also here is where I will also the fifth intercostal space where the mitral valve is also the PMI, and it's also where you would look for a murmur. Go ahead and have a seat and lean forward for me. I'm going to check for a murmur. I don't hear any murmur. I'm going to go ahead and also take her breath sounds. Turn it back. In the 6 areas that I should auscultate in. Take a deep breath. Blow it out. 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 Okay. I'm also going to assess for tactile friendliness. So I'm going to put my hands on her back, and I'm going to have her to say 99. I'm going to feel for tactile friendliness. 99?
99. 99. 99.
Okay. I feel vibration when she says 99, but I do not feel tactile friendliness. So when I assessed her lungs were clear. There was no consolidation, egophony, or bronchophagy. I didn't hear anything with her lungs. For her chest, I heard lub dub, which is S1 and S2. I did not hear any extra S3s or S4s, and like I said, I did not hear any murmur. So I did the chest. I'm gonna go ahead and do your abdomen now. So I need you to go ahead and lay this way. So the first thing I'm going to do is I'm going to palpate the abdomen. I'm going to auscultate the abdomen so that I don't give her increased bowel sounds that she should not have. Okay. All right. She has bowel sounds. You can hear like a little gurgling and popping in there. She does have some striae. Other than that, the skin is nice and smooth, and the abdomen is round as it should be. I'm gonna go ahead and percuss the abdomen. Tell me if you feel any pain.
No. 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 No.
Okay, I'm gonna go ahead and palpate the abdomen. Light palpation. Any pain?
No.
Any pain?
No.
Pain?
No.
Pain?
No.
Okay, I'm gonna go ahead and do a deep palpation. Any pain?
No.
Pain? Pain?
No.
Pain? Okay, I'm gonna also assess the liver to see if I can feel the border of the liver, which I should not. I don't feel the border of the liver, so the liver is not enlarged or anything like that. I'm gonna also check her appendix by doing pulsasis and arbitrary. Can't say it right, but I'm gonna do arbitrary first. Okay, go ahead and lift your leg. I'm gonna bend your leg out. Tell me if you feel any pain in the abdomen.
No.
Okay, good job. Okay, go ahead and turn to your side. I'm gonna do the pulsasis. Tell me if you feel any pain.
No.
All right, turn back flat. And then what I'm going to do now is I'm going to do range of motion on the legs. Okay. I know what I forgot, but I'm going to go ahead and do range of motion on the legs, and then I'll go back to assess your deep reflex tendons. Okay. I'm going to lift your leg. Any pain?
No.
Okay. Any pain?
No.
Any pain?
No.
Okay. Any pain?
No.
All right. Any pain?
No.
All right. Any pain?
No.
Any pain?
No.
Pain? Okay. Good job. I might as well do your pulses because I believe she'll see me better if I can do your pulses here. I'll do it again once she's sitting up just in case. Okay, go ahead, lift it up. Turn this way. All right. Let me finish this real quick. Go back to your reflexes. I'm gonna hold your arm like this. I'm gonna hit your reflex, your tricep reflex when you feel it. Your arm should move a little. Okay, I'm gonna do the brachial. And I'm gonna do the brachial. Okay, now I can move the brachial articular, okay? Okay, I'm on the other side. I'm gonna do this. Good. Brachial. It's gonna be 2 inches up above your actual brachial artery. Good. Brachial articular. So we did the tricep, the bicep, and the brachial articular. All right. Let's see what else we need to do. Do this. Stand up again. I'm sorry. Oh no, did we do this?
Yeah.
Oh, okay. So now, since I have you standing up, we'll go ahead and do your balance. So I need you to close your eyes, hold your arms out, turn them over. How you feel? Good. Okay. Go ahead and open your eyes. Put your arms down. Very good. Now I want you to walk this way. I want you to do the heel to toe to check your balance. Very good. All right. Come back. Go ahead and. All right. All right. Go ahead and sit down. I hate to have you to lay back down again, but if you're going to do something, I'm going to do it now. We're going to check your abdominal arteries. Okay. Go ahead and lay back down. I'm sorry. This is important to do, or else I would not have you lay back down, but we need to know. So first, we're going to check your renal arteries, then your iliac, and then your femoral, and your aorta. So I'm going to turn to the bell. I'm going to check your aorta artery first. Okay. Then I'm going to check your iliac. I'm sorry, your renal artery. Okay, then your iliac artery. for more arteries. Here, go ahead and get up. Arteries sound good. I don't hear any bounding. I don't feel any pulsations or anything like that. I'm also going to check your carotid artery. So I didn't do that. That's also important to make sure you don't have any bruise, or threads. What's wrong? Is that just part of your Okay, look for it. Very good. It sounds good. Ooh, that light. All right. I did my Romberg. I did everything I can think of. I'm going to go ahead and test the strength in your lower extremities. Okay. Um, go ahead and pull back. Okay. Push forward. All right. Lift your foot up. Push down. All right. Push down. Oh, let's go up. Okay. I'm gonna go ahead and do a Bembinski. Below your foot. So when I do this, your feet should fan. All right. Okay. I'm gonna go ahead and check your knee reflexes. Okay, very good. And then we're gonna check your Achilles reflexes. I'm gonna flex your foot, and it should push down. Good. Okay. I'm also going to check your foot reflexes on your leg. Go ahead go ahead and push one foot down, like one, and now do it real fast. Okay, very good. Let me see how much time I have. 22 minutes. I think I did everything. Oh, lay down. I got to check your hip. I didn't check your hip. I'm sorry. I'm sorry, man. Any pain?
No.
Any pain? Okay, just making sure you don't have any pain in your hip. Okay, let me cross your leg because I would just in case I didn't with the range of motion of your feet. Okay, go ahead and sit up. Promise you I won't have you lay back down again. Just trying to think to make sure I did everything. I'm gonna go ahead and wash my hands. Oh, did you stand up for me and bend at the waist so I can check your spine? So I don't think I checked your spine. Your spine is midline. Okay, go ahead and get up. Very slow. All right. Trying to think. Go ahead and have a seat. I looked in your ears, your eyes, your nose. I did your vision test. I did your head, your skin. Let me do your pulses. I don't remember if I did your pulses. Your pulses are 2+, not bounding, not threading. I'm going to check your capillary refills. For oxygen, you're very oxygenated. They go from pale to red very quickly. She doesn't have, she has toenails on, so I'll check the tip of her toes right here for oxygenation. Good. Very good. Check this one. You can feel me here? You feel me here? Feel me here? Okay, so we did that. Just trying to think of anything that I forgot. I don't think there's anything else that I did not do. Nothing that I can think of. My time. I don't know. We checked your strength. We did that. We did your legs. We did your back, your uvula, your ears, your eyes, your nose, your throat, your heart, your lungs. I checked your carotid artery. I checked your aortic, your pulmonic, your tricuspid, your mitral valve, your PMI. I checked for murmurs. There were no murmurs. Overall, you look like a healthy individual. Do you have any history of surgeries?
No.
Do you take any medications? Okay. Um, so no surgeries, no medications, no past medical history, no high blood pressure, diabetes, no family history of any of that.
No.
Okay, good. Um, do you have any children?
No.
Okay, very good. When was your last menstrual period?
2 weeks ago.
2 weeks ago, which was around about like the first, so the beginning of the month. Okay. Any pain or discomfort when you're okay? So this is gonna conclude my assessment. Thank you. Have a good day. I'm gonna wash my hands before I leave. Have a good day.